Hi, I'm Dr. David Tyson at Amarillo Family Physicians, and I've been working with BIOTE hormone replacement for about 10 years, starting about 2016. It's been a great option for hormone replacement for both men and women. We kind of got started looking at that because we saw so many people in the 35 to 50-year-old range that were having problems. They were getting tired a lot. They were having trouble sleeping at night. Noticed that they just didn't have the energy levels that they used to. And if you start asking them about some of those symptoms, you realize it's not just that. They're having a hard time losing fat. They're having a hard time building muscle. And nobody was really helping them figure out how to correct that. There's a lot of times you get a bunch of blood work done, particularly for women. They're going to look and see if you're in menopause, and no, you're not in menopause because you're not at that age yet, but they all knew something's going on. Well, BIOTE is pretty much a great answer for people that are in that age group that are suffering from testosterone levels starting to drop off. It's very easy to kind of figure that out. It's just blood work to do that. But the BIOTE provides a pellet that is made from bioidentical hormones made from soy. And this is something that can be replaced in women about every 3 months and men every 6 months. That longevity of treatment makes it easy to maintain your symptomatic relief for the whole time. We've had for a long time other replacement strategies that include gels or shots or pills that only last a day, a week, and the only problem with those is that a lot of times you wind up getting symptoms recur, especially if you forget a dose, especially if you run out of your medicine. With BIOTE, it makes it very easy to maintain that treatment for the 3 or the 6 months at a time and provide a lot more symptomatic relief, but also a lot of relief with some other metabolic problems. We notice that your cholesterol actually gets better, you metabolize glucose better, and we know for a fact, especially with women, the effect on bone is even better than a lot of the medicines that we use to restore bone because of osteoporosis. So the symptomatic relief is great, but there are a lot of metabolic things that happen with that don't happen necessarily with other treatments. And it's a pleasure to see people do so well and get so much relief from that kind of treatment.